Hello everyone, and welcome to another audio podcast under this series, the LabZtorm Impact V2. This is the Shientist, and it's an audio podcast on a retrospective on the British Renal Society, or the BRS, between 2010 to 2022. So just over a decade, and this is another Storm Lobostics production. And so what I thought I'd do is give an overview in this audio podcast, an overview surrounding the British Renal Society, which is which in which has after several numbers of years has changed. It was in 2021 the British Renal Society merged and changed its name to from the British Renal Society to the UK Kidney Association, or UKKA. And the UKKA and the British Renal Society, whichever way you look at it, also are linked with the Renal Association. So I'm going to talk about a little bit about some of the history, but I'm also going to talk a little bit about some works that had been presented presented in around 2012 and 2013 by different colleagues, by sort of annotating some of the works some of the works that had been presented under particular themes at 2012 and 2013 conferences. Also to note, as part of this this audio podcast, there's a Professor John Feehally, who's a nephrologist in the UK. In a YouTube video, he provides his personal reflections on the Renal Association achievements during the time during the years that the British Renal Society and Renal Association have been around. So I'm going to provide a sort of an overview of the British Renal Society in this audio podcast, and then, as I said, I will talk a little bit about some of some works that had been presented, in particular around 2012 and 2013. So the Renal Association was founded in 1950, believe it or not, 1950, and long before nephrology existed, apparently, as a coherent clinical specialty. And indeed, before the term nephrology, or the study of kidney care practice, was even coined. The Renal Association is or was the oldest continuously proactive nephrology society in the world, long preceding, for example, the International Society of Nephrology, the ISN, which was founded in 1960. And the EDTA, EDTA and ERA, which were established in 1964, and the American Society of Nephrology, the ASN, which was established in 1966. So in its early years, the Renal Association's primary goal or function was to run meetings for scientific discussion of the structure and function of the kidney in health and disease. And so from about 1960s, once clinical nephrology emerged when RRT, or renal replacement therapy, developed, the Renal Association grew steadily. And so by 1970, there were 200. The 250 members, reaching 10,000. Reaching 1,000. Reaching 1,000 in 2008, and then about 1,400 in 2020. And the scope of Renal Association activities has continuously expanded, involving all aspects of modern nephrology and kidney care. So the Renal Association has played a key role, in driving the sufficient provision of chronic dialysis and establishing and sustaining kidney transplantation. Um, following the first transplantation in the UK, which was performed actually, apparently so, in Edinburgh in 1960. So more recently, the Renal Association has played a major role in improving detection and awareness of chronic kidney disease, noticeably through estimated glomerular filtration rate reporting, and improving detection and management of acute kidney injury. So the modern Renal Association is involved, or has been involved, in education, research, training, and clinical service delivery, making up the multifaceted profession society that specialists and specialists and those those who know, from a multidisciplinary team perspective, know of today. So in line with this, sort of overview, I'm going to mention a little bit more about the sort of the sort of current, the more some of the current sort of updates that have surrounded what was known as the British Renal Society, and in keeping with sort of some aspects of historical context, but also, of course, sort of other aspects in relating to British Renal Society, or UK Kidney Association affiliations. So in June 2021, last year, the multi-professional focus of the British Renal Society and its affiliates merged with the work of the UK Renal Registry. The UK Renal Registry and the 71-year history of the Renal Association to create the membership, the UK Kidney Association, or UK Kidney Association, or UKKA. In line with this, at the same time, the affiliations that were under the British Renal Society had merged, along with the British Renal Society, into the UK Kidney Association, and those affiliations included the UK Renal Registry, the Kidney Quality, the Kidney KQIP, which is to do with the kidney quality, and improvement sort of audit related affiliation. So where KQIP develop audits around particular areas of practice, Then there's the Renal Pharmacy Group. There's also something called Rare Renal, which is basically a database, or an organization which houses particular aspects of rare conditions associated with renal disease. And then there's the BAPN, the British Association of Pediatric Nephrology. There's something called the specialist, this SPR club, which is, I believe, my understanding is referred to as the specialist registrar club. Then there's something called Patient View, which is a electronic patient records, which actually is made available for patients to access their renal results, their kidney results, at pretty much anywhere. Around the same time, probably last around 2021 as well, if not a little bit before, Patient View merged or linked with another organization called PKB. PKB is an organization which also started as a basic startup, and linked, and actually developed similar to Patient View, but actually has more disease related specialties, and not specific to renal. PKB stands for Patient Knows Best. So Patient View and PKB became a link in around the same time, 2021, 2021 or thereabouts. And then before Patient View, it was known as patient. Before Patient View, Patient View had a different name. It was called Renal Patient View. It still did the same things, but what happened is that colleagues in Edinburgh, for example, colleagues in Edinburgh did prompted the electronic patient record, so that it could be so that other specialties around medicine could use Renal Patient View as a way to involve patients across other specialties to access their tests and investigations, etc., in other diseases. And so one of the founders, who's actually based in Edinburgh at the time, I believe still is, and basically it was some years ago, before Patient View became Patient View. It was Renal Patient View. Renal Patient View piloted effort where other specialties could actually have patients document and link aspects of their tests and investigations. And then there was another colleague. Who approached the patient panel, which was known as the patient panel under the Renal Association, and the patient panel around between 2000, I believe it's 2000 and between 2018 to 2020, 21, if not before, where 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 one of the leads for Patient View had said, or Renal Patient View had said that they were not happy. They were not happy with how Patient View, or Renal Patient View has been working, because they did have a link with a disease, a specific another specific specialty, and basically, apparently, a link with that specialty slowed down the electronic patient record use for everyone, generally speaking. And so what happened is that in that time, there was, as I mentioned, Renal Patient View became Patient View. It became Patient View, probably in the last five or 7 odd years. I think. And so in around the last 3 years, though, however, in the last 3 years, it then linked. It then linked where Patient View was linked to Patient Knows Best. Now, apart from that, again, on the website of the UK Kidney Association, Professor John Feehally provides personal reflections on the Renal Association's achievements during the 71 years that it has been established. And that's freely accessible, or accessible through the UK Kidney Association website, and there's a YouTube video. And Professor John Feehally is an archivist for aspects of nephrology practice, and a professor in nephrology. Now, apart from that, I'm now going to, or in addition to that, I'm now going to provide a little bit of a bit of an overview on some works that had been presented at the British Renal Society in 2012 and around 2013, and these are works that are under different themes, that under different themes of sort of renal practice. And so I thought I'd provide an overview, having contributed in works around the British Renal Society. I've not really been involved in the British Society, and I don't know for sure, but it could be something to do with the color of my skin, not least that I have a health professional background. So anyway, I'm going to give an overview of this. So there was in 2012, in 2012, the conference took place in uh, in uh, in yes, the British Renal Society annual conference in 2012 took place in May 2012 in Manchester, in the northwest, UK, and the remit, or the general theme was to do with nephrology practices, and the the one of the themes, one of the presenters talked about a paradigm shift where they were saying, we're talking about how the old method would be more like more where if you imagine a patient at bedside, and where a medic would talk down to the patient to retrieve, for example, to retrieve a history and examination, or H&E. And the shift, at least in an illustration, and I'm sorry I can't show the illustration, but I am annotating this illustration from a presentation that was given. And basically the paradigm shift was where, from that to the new method where a patient and a doctor would be in a consultation area, in a consultation room. The screen relating to the patient's results would be in front of them, and the patient would be able to see their results on screen. And so the picture, or the sort of photograph, gives the impression that by turning the screen, the patient sort of understands their tests and investigations, etc., through communication. Now, apart from that, the illustration has a main title in this particular sort of illustration, highlighting patient involvement, and patient involvement generally in nephrology practices, dare I say it, is actually historically has been quite a sham. And I say this with some aspects of confidence, basically because it was in around 2008 or 2009 that patient view, for example, patient view, as I said, is or renal patient view, as I've mentioned, is an electronic patient record, and basically renal patient view back then tried and tested a sort of an online forum on their electronic patient record, where, for example, a patient and professional could post something on the online forum. However, patients, when doing that, or professionals when doing that, found that after they put a query up or something on patient view or renal patient view, they were not getting responses. So at the same time, it was when founders of the Renal Patient Support Group, RPSG, identified in some contexts that actually patient care actually needs to be real time. So when posting something on an online forum, basically in an online forum, basically on patient view, there was response to particular questions. However, the responses would actually turn up online through patient view or renal patient view back then, probably a week, maybe 2 weeks later. And so the founders of the Renal Patient Support Group, the RPSG, identified that in relating to patient care, they thought the founders thought that actually what should happen is that we should take the opportunity and harness the use of social media. Because in some contexts, social media, even around 2009, though slow, it still offered opportunity where there would be real-time responses to particular queries, whether sort of lived experience, shared experiences, clinical or semi-clinical clinical or semi-clinical advice, etc., etc., etc. So basically, the electronic patient record, patient view or renal patient view actually wasn't doing what it was supposed to do back then. And then at this conference at the British Renal Society, one of the presenters talked about the paradigm shift and patient involvement. There was quite a few poster presentations, and as I flicked through some of some of the photos, etc. There was one poster here around in the British Renal Society conference around 2012, that looked at developing a smartphone app for young people with chronic kidney disease, and I'm going to just highlight a little bit around this. And this poster presentation came from the Guy's and St Thomas National Health Service in London, and the team talked about developing a smartphone app for young people, and basically they said back there, they say developing effective information and education is an ongoing challenge for health professionals, and this is particularly pertinent in the young adult population. Effective communication is vital during transition, when evidence suggests that up to 35% of transplants will be lost due to poor concordance with medications and clinical appointments. Identifying relevant and innovative ways of interacting with young adults is important to supporting them to develop self-management skills. They go on to say in this poster presentation that using interactive communication in partnership with Guy's and St Thomas Kidney Patients Association, a smartphone app had been developed and aimed initially at young adults, and the design and focus allowed young adults to own up-to-date and accessible information 24/7. In line with this, there's some additional data that the poster presentation highlights, and so for example, about 60% of teens, for example, in relating to healthcare practices, are highly addicted. About 60% of teens are highly addicted to using smartphones. Technology is playing an increasingly important role in the lives of young adults, and nearly half of all teenagers apparently own a smartphone. In this poster presentation, 60% of teens are highly addicted to smartphones, and smartphones are beginning to affect social behavior. And there's a paper that they've cited from 2011. So in line with this, they also say 50% of respondents in part of the work that they've highlighted in this poster presentation felt prepared to transfer to adult kidney care, but expressed anxiety about leaving familiarity of pediatric pediatric nephrology services. 86% of respondents felt they had a good understanding of chronic kidney disease, and mobile phones were identified as preferred communication media, and the follow and so and the follow and there's some statistics that they've provided, some descriptive statistics that they've highlighted, so for example, 53% own a smartphone, 63% use a kidney care app, 70% want appointment text reminders, and 94% own a mobile phone. I don't know what the difference is between the 53% own a smartphone and 94% own a mobile phone. I don't know. I don't actually know the difference. Anyway, when asked about information needs, respondents identified the following as hot topics: help me to manage my kidney care, but don't lecture me. How can I meet other kidney patients at my age? Can I travel? How do I manage school, uni, work, and money? And how do I live a normal life with chronic kidney disease? So this was a poster presentation that came out from the Guy's and St. Thomas's team in London. And as far as I'm aware, things around young people going through kidney disease or going through kidney disease are a bit better. But there is data to highlight actually smartphones or mobile phones, irrespective, generally use lots of different ways to access understanding. But this was an informative poster presentation for that time in 2012. So the next one I'm going to talk a little bit about is excuse me, is peer support for kidney patients by kidney patients. And this is basically a poster that came out of the West Midlands Renal Network, West Midlands Renal Network, which had a collaboration with the Northeast Renal Network. And so in this poster presentation, they talk a little bit about peer support for kidney patients by kidney patients. The main thing was that they say that the main thing they say, in addition to aspiring to provide a key benefit to patients accessing the service in the form of delivering meaningful information, emotional support, motivation, hope, and encouragement, involvement with the service has been beneficial for the recruited peer supporters. The peer supporters have improved their communication skills, but new friendships learned new skills. The peer supporters have improved their communication skills, but built new friendships, learnt new skills, and have become part of a meaningful network of support to kidney services. The overall context in here was that so a few comments here, a few quotations, direct quotations, as part of this work and this poster presentation. Nothing prepared me more than going for a beer with someone who had been through what I was going through, and that's from a peer supporter, a live donor, and carer. Another direct quotation was, it is payback time for the good care I have received. That's from a peer supporter and a live donor recipient. And then there is another quote, the final quotation here. It is such a big culture shock that affects home, family. It is a really scary. It is really scary. I don't want to help other people. And this was a direct quote from another peer supporter at a satellite hemodialysis unit. So that's another poster presentation. Uh, another intriguing piece of work was was yes, another intriguing piece of work what that came from a Welsh team, came from a renal department in Wales, um, and they did a poster presentation on CKD group education, an effective method of delivering information to patients and carers. So what they did here was was where they said patients with diagnosis of chronic kidney disease require information about the condition in order that they may better understand disease process and make informed decisions about their care. Having assessed our practice, they identified that there is a need for a more structured method of education delivery, drawing on the success of group programs in other chronic conditions. It had been agreed that the group education should be trialed. So what they did was they um, they implemented an agenda to as part of a recruitment process, and there was a support information sort of an information sort of kit or toolkit for those who were part of this initiative. So the aims of the of this particular work were to promote self-management through an improved knowledge base and introduce patients with carers to renal multidisciplinary teams. And they invited a maximum of 12 people per group, 6 patients and 6 carers, to an informal sort of an informal day which took place over an afternoon. We They hope to what they had hoped to do is alleviate any anxiety regarding possible future referrals and treatments by encouraging open discussion. Information was delivered using a variety of methods, and these methods included DVDs, PowerPoint, and oral presentations, all of which were accompanied by supporting information. Um, and renal replacement therapies were also discussed and explored, and the evaluation around this was that the first part of the first evaluation, which took place 2 years before. So this presentation was in 2012, and the evaluation took place in 2010. And then over the period of a year, seven sort of additional events were held in total. So 34 people attended, 21 male, 13 female. Average age was 64 years of age. All patients were informed that the session was a new initiative, and at the close of the afternoon or during the time when this was done, were asked to complete an evaluation from rating component complete an evaluation form rating component rating a component parts of the evaluation, or the components from 1 to 10, and there is in this poster presentation a sort of an outline of those of the evaluations that took place. Statements of support from patients included, well, this would benefit others. It was helpful to meet the team and fellow patients, and please can this be offered a lot earlier in the patient's journey through chronic kidney disease. It would have made such a difference to our family. Some concluding aspects around this particular poster presentation included, to begin with, only those patients with CKD stage 5 and lower levels of CKD stage 4 were invited to these events. And following initial successes, following initial events that took place, and how they were implemented, subsequently have apparently had been rolled out to become to those patients with estimated glomerular filtration rates of less than 20. Anything less than 15 millimoles per liter in related to estimated glomerular filtration rate is deemed as end-stage renal disease. And so they invited patients and carers. And so they say here also in this poster presentation, there is a potential to work with expert patient program colleagues and develop preliminary care based efforts for those with chronic kidney disease stage 3, and there have been notable time and cost savings. 21 hours group education and opposed to 64 hours one-to-one education, and events continue to be rated highly and shall and continue to run for the foreseeable future, with plans to modify and expand. So this was again a poster presentation that came out from a team in Wales. Another poster presentation I'm gonna highlight from the 2012 conference was something to do with transition service. So from pediatrics to adult, from pediatric nephrology to adult nephrology, and this was a kidney care, NHS kidney care poster presentation. Kidney care, NHS kidney care existed for a short time. It's now, as far as I understand, does not exist. NHS kidney care does not exist. And so this poster presentation had several aims. So the self-assessment was a gold standard transition document informed by the relevant National Service Framework and the Department of Health. Now, the National Service Framework dates back to 2004 and 2005, and there are two framework documents that were published by the Department of Health in relating to kidney care practices. One covered renal replacement therapy in relating to dialysis treatment. A second one focused on nephrology practices in related to transplantation, and in relating to aspects of some parts in relating to end of life care as well. And the self-assessment framework aimed to enable services to benchmark against it and understand where improvements were required, this will be the idea was to of this poster presentation was to highlight initial findings, and this would be repeated, or the self-assessment framework that was highlighted in this poster presentation would be repeated at the end of the project once improvements had been made. The overall work was to develop a sustainable service that was considered across the whole of the region using the self-assessment framework results as a focus, and measurement. The standard assessment framework assessed the following. So these are the main things that the standard assessment framework had. The current knowledge of staff regarding transition, the provision of services for young adults, the policy regarding transition from pediatric nephrology services to adult nephrology care, and then gaps in service provision at each unit, and then good practice, highlighting good practice to be shared, and then also and finally to gain an understanding of different practices across the region. A little bit about the method around this particular poster presentation. So the project started in around January 2011, and the assessment framework was sent to 6 different units involved in the project, with a letter explaining the purpose and the process in March 2011. It was suggested that there should be a multidisciplinary approach in order to get a full picture, and the key worker offered support in completing if it was an issue. The document was scored using red, amber, and green measurement, red, amber, and green sort of colors. Red was self-assessed as not reaching the standard, amber as partly reaching the standard, and green as delivering the standard. Of those who self-assessed as green against the standards, evidence was required by the team, by the leads of around this particular work, as a basis by which to ensure to share best practices. And so the self-assessment framework covered six different focuses around transition from pediatric nephrology to adult nephrology practices, in order to understand if each NHS trust or hospital had a strategy in place and supported by policies and procedures, and whether these translated to working and accessible documents and practices at unit level. Each one of the 6 headings follows a young adult with kidney disease, and by self-assessing in red or amber against, any of the standards, shows any of the standards, and shows clearly where the patient's experience could be improved. There's a table in this poster presentation, and I'm not going to annotate what's in the table. However, I will highlight a little bit about some of the service developments. So young adults were interacted from the outset of the work in order to gain an understanding of how experience of transition between pediatric nephrology to adult nephrology could be improved. A survey was held to capture what those improvements would be, and these alongside the assessment framework results were used to develop services. As a result, the following developments were actually put into place. And this is work that again came out of NHS Kidney Care in around 2012, and it was actually a team. It was actually a team at the North Bristol NHS Trust, NHS Kidney Care, and Bristol Children's Hospital, and the renal, and it was the no, it was the renal Peninsula Network that led the work. So what they did in this time, communicate so the following developments were put in place. So there was communication and information sharing through Facebook, social media, texting, and texting. There was a development of an evidence-based pathway incorporating all elements of transition and transfer as requested by young adults. And there was a young adults clinic with multidisciplinary support with other agencies input. There were educational seminars for staff in each unit highlighting the issues that young adults may face and how to support them. And then there was a resource sort of bundle made available to each unit, offering signposting service for young adults to access external and voluntary agencies. So that was another overview of another poster presentation, and I'm going to highlight a few more, and then I'm going to move onto an overview of this particular an overview of this particular audio or podcast. So there was another poster presentation around another important topic, and this one was about supporting young adults living with chronic kidney disease and their educational and vocational needs. This was a poster presentation that came out from NHS Kidney Care. It was a collaboration between the North East Renal Network, the Newcastle City Council, City Hospitals, Sunderland NHS Foundation Trust, South Tees Hospitals NHS Foundation Trust, and NHS Kidney Care. So a little bit around this particular work. So the National Service Framework for Renal Services, and this National Services Renal Services Framework date back to 2004-2005, and as mentioned, there's two framework documents, and stated that transition should be a process. Transition, a transition in this context is to do with from pediatric nephrology services to adult nephrology services, and should be a process that addresses holistic needs of adolescents and chronic medical conditions as they move from children's to adult nephrology services, including addressing educational and vocational needs. Other studies have also been identified, and the importance of providing opportunities for young adults to discuss their concerns with skilled members of staff. So, for example, a sort of a main health professional worker, young adults who have lived with chronic kidney disease or CKD since childhood may have their cognitive ability affected by chronic kidney disease, by renal failure, and this, along with missing school and other opportunities, can mean these young adults are at risk of not achieving the same level of educational success as their peers. And one of five project groups commissioned by NHS Kidney Care. Again, NHS Kidney Care doesn't really exist anymore as an organisation in the United Kingdom, but at the time, as one of the five project groups commissioned by NHS Kidney Care to develop ways to support young adults with chronic kidney disease. The Northeast group at this time was focusing on supporting educational and vocational needs as one of the main areas of service improvement. And so what they did was sorry, yes, what they did was the yeah. So what they did was um, they put together a questionnaire, and it was developed in conjunction with local education and employment support worker, and there was an organization, um, it was a health professional there was a health professional involvement in part in relating to this work, and there was a distribution to young adults between the ages of 18 to 25 with chronic kidney disease stage 4 and 5, including those with kidney transplants. Information collected included demographics, level of education attained, and current employment, fatigue, previous support, and derived support. The aim of the questionnaire was to begin to understand young adults' education and vocational requirements. 20 young adults, so that's 20 young adults completed the questionnaires out of 30 that were handed out. And so what they found was that uh, that around 80% wanted further information on education and employment. Around around 60% of young people were actually unemployed. 60%, that's 60, were unemployed, and yeah, so 60% were unemployed, and there's some other data in there, in here as well. So the young adults had suggested the following, though, as part of this. So they suggested that helping with specific aspects of the project of the work that the researchers did. For example, designing aspects of the research, and putting together the information around aspects that pertain to chronic kidney disease. So was positive. So that was around 33%. Being involved in evaluation and service development as part of a panel, and a committee, and questionnaire design or service evaluation. So 20% had highlighted that was a positive. And then other more specific suggestions included peer mentoring, around 40%, and then driving to take young people to and from events. So around 26% were positive around that, and administrative duties around 6%. Overall, this work had highlighted that improving young people's experiences of transitioning between pediatric nephrology services to adult nephrology services was generally a positive sort of experience. In relating to that work, and this was another form of another poster presentation that was linked with NHS kidney care. Was another one that had an association or a link with so there's NHS kidney care. There was Guy's and St Thomas's in London. There was the North East Renal Network. There was the Oxford Kidney Service. There was the Royal Berkshire Hospital. There was the East Midlands Project Group, and there was the Nottingham University Hospitals NHS Trust, and Derby Hospitals NHS Foundation Trust, and there was the North Bristol NHS Trust, who was involved in this work. And they highlighted that NHS Kidney Care commissioned 5 project groups caring for young adults in England to develop innovative approaches to improve healthcare services, and these approaches center on the role of main workers as drivers of culture change and practice in multidisciplinary teams. Posts are based in adult services, but work across both adult and pediatric services. And so some some of the main workers cover multiple trusts as well as primary care and other settings. Achievements identified within the 5 projects included setting up a dedicated young adult clinics. Some of those took place outside the hospital setting, increasing professional awareness of the needs of young adults through a range of educational activities, and developing greater peer support of young adults, including through social media such as Facebook and Twitter. Again, this is works that was presented at BRS, British Renal Society, in 2012. They highlight in this work they used another evaluation method. So in order to highlight main learning and best practice for dissemination for the work, an independent evaluation was carried out, and the workers from each initiative were interviewed, and 7 participated in a face-to-face group interview, and 3 participated in a telephone interview. Interviews explored implementation of the role of main workers with specific focus on their duty. Number 1, duties involved, and number 2, the qualities and competencies which they perceive necessary to carry out the work, and then number 3, interactivity with young adults and the project group. Number 4 was the challenges experienced, and number 5, successes and learning and the learning acquired. And sustainability of services in each initiative, in the absence of the main worker, was explored. Data was transcribed and subjected to thematic analysis in order to identify main themes. And the main themes were as follows. And I won't read the findings, I'll just read out the themes in this. So there was roles and responsibilities, there were skills and attributes, there were achievements, there were unexpected illnesses and challenges, and there was sustainability. The conclusions around this, and again this was from 2012, they've highlighted that the findings highlight that the findings highlight the issues units need to consider developing services for young adults and in staff recruitment. These will be of intrigue to the kidney community, as well as those caring for young adults with other conditions. Other project outcomes include other initiative outcomes included the evaluation report from the initiative, and that was later available in 2012. I'm going to finish with this in this particular audio podcast. There's going to be another follow-up in relating to the British Renal Society 2013. So this is part 1 of this particular audio podcast. So I'm going to finish with this, and this was part of a presentation that one of the presenters gave in the 2012 British Renal Society conference. They say it's headed chronic kidney disease, and it says this places new long-term demands on healthcare systems. Not only will chronic conditions be a leading leading cause of disability throughout the world by 2020. Obviously, we're now in 2022. If not successfully managed, then patients will become the most expensive problems faced by our healthcare system. So while global disease burden has been shifting towards chronic conditions, healthcare systems or health systems have not developed to meet this changing demand. Care is fragmented, focused on acute and emergent symptoms, and often without the benefit of complete medical information. I mentioned in the earlier parts of this audio podcast, one of the slides said one of the presentations was where there was two pictures. One was a cartoon where it was a patient at bedside, and there was a medic looking down at him to get history and examination around the patient. The second picture was actually a photograph where a patient and a medic were in communication. The screen screen was turned slightly so that the patient could look at the results around their test and investigations. The heading of that particular presentation was in relating to patient involvement and in relating to a paradigm shift. So in 2012, that was the remit. Unfortunately, I can't remember the remit of the British Renal Society conference in 2012 as a general theme, but in 2014, involvement was becoming more important. However, in 2012, it was still developing. Healthcare professionals were still lacking in their understanding of inclusive healthcare, and so in relating to this, hence why so the slide that I've just read, or the overview I just read, actually came out from the World Health Organization, specific to chronic kidney disease. And they've said again, care is fragmented and focused on acute and emergent symptoms, and often provided without the benefit of complete medical information. And it is basically because health professionals have actually been very much focused on their own needs and not patient care needs. That is the reality of how health professionals think. And so I leave this audio podcast on that basis. So this was an overview around the British Renal Society between 2010 to 2022, with a little bit of history around the British Renal Society and what's changed and developed around that. The next one I'm going to talk about around the British Renal Society, and in specific around 2013 sort of conference that they've had, and it will be a part two of this particular overview as well. So I want to say thank you for listening to this audio podcast. It's been the Shientist. It's a series on the LabZtorm Impact v.2. It's a retrospective on the British Renal Society 2010 to 2022. It's another Storm Robotics production, and Thank you for taking time to listen. Hopefully catch you on the next one. Thanks.